Good evening. My name is Meg Wheeler. I am a candidate for the Massachusetts State Senate in the Plymouth and Norfolk District, and I'm here tonight to give you a COVID-19 update. So just to start things off, I wanted to give you an update on where we stand numbers-wise. So statewide, we now have tested over 94,958 people. That's an additional 7,447 people who were tested today. I believe that is our highest day of testing so far. In terms of positive COVID cases, our statewide total is now at 18,941. That was a jump of 2,151 today. This is our largest jump in the number of cases, but it corresponds with the large jump in the number of tests, so not necessarily unexpected. Very sadly, our statewide death total is now at 503 people. We saw an additional 70 deaths today. This was not our highest day of fatalities, but nonetheless, people are still passing away from this. Our numbers are still high. So across the United States, the total of positive cases is now 452,000, with 16,129 deaths. So the numbers are continuing to increase, but there have been some positive signs that the amounts that they're increasing by are not necessarily as much as they've been increasing in the past. The governor continues to say that based on the experts who are studying this, we do expect the surge of cases here in Massachusetts to be sometime between April 10th, which is tomorrow, and April 20th. But of course, we can't know that for sure. So it is incredibly important that we continue to practice social distancing. We continue to stay at home if we are able to, that we only go out for the absolute necessities, and that if we go out, that we wear masks and we practice the social distancing rules. So I do want to give you some updates on the state level. We have an update on unemployment benefits. So, 470,000 residents have filed for unemployment benefits in the last 3 weeks. This is obviously an incredible increase in the number applying over normal times. The state has now received guidance on how to process the additional unemployment benefits from the Federal CARES Act. So just as a reminder, the additional benefits as a result of the $2 trillion federal stimulus bill that was passed a couple of weeks ago. There are 3 of them in particular. The first is an additional $600 each week for up to 4 months for every single person on unemployment. Now, this is retroactive to March 29th, so even if you haven't applied yet or you haven't received your benefits yet, this will go back to March 29th. It'll continue through the end of July. If you already qualify for unemployment and you're already on unemployment, then you will see this additional $600 start to come in with your amounts moving forward. You don't need to do anything additional to get this money. So that was the first sort of expansion of benefits. The second expansion of benefits under the Federal CARES Act is that they will now provide unemployment benefits to those who do not normally qualify for unemployment, most notably those who are self-employed, freelancers, gig workers, etc. Now, we learned today that the state, they've received guidance finally from the federal government on how to process claims for these folks. But the state announced today that they do not expect to be able to process these benefits for the self-employed, for freelancers, for gig workers until April 30th. I'm going to talk about that in a second, but I just want to clarify one thing. So if you are already on unemployment, if you already qualify for unemployment, the additional $600 per week, as I said, you'll automatically get that. You don't have to do anything. If you do not currently qualify for unemployment, but you will qualify, or you do qualify under the expanded federal guidelines, you will also get that $600 extra per week once your benefits start to kick in, once the state is able to get you up on the system, and they will be prorated back. So even though you're not necessarily receiving funds now, you will get that additional $600 per week. So the reason for this delay through April 30th for people who are self-employed is that apparently the state is working with a third-party vendor to set up a separate site in order to process these claims. Excuse me. Now, I do want to note here that while I can imagine that this process is incredibly difficult for the state, they had to wait for guidance from the federal government. Obviously, we're talking about an incredible number of people now filing for unemployment that they just weren't prepared to handle. I think what is incredibly concerning is the fact that a lot of people, anyone who's self-employed, who is a gig worker, who's a freelancer, a lot of people are being asked to wait almost an additional month to get any kind of relief. And I think, frankly, that is unacceptable. And when I look around the country and I look at other states and the fact that they've been able to get these benefits up and running, I have to ask, why are we not able to do that? Why are we not in a position to do that? Is it because we're failing to do something now that we should be doing? Or is it because we just weren't prepared for our system to be able to adapt to these situations? Either way, it's unacceptable. And we will stay in constant contact with the Department of Unemployment so that we can understand what is changing on this. When there are updates, we will bring them to you. But to ask people who are suffering right now, who are unable to pay their bills, to wait an additional nearly month to get benefits, I think is completely unacceptable. So if you are one of the folks who falls into that bucket where you would not normally qualify for unemployment, but you do now under the federal plan, please know that applying now will not do anything for you. You will most likely you'll get a rejection. At this point, you do need to wait till the state gets a new system set up. It's incredibly infuriating and frustrating. And I'm very disappointed in the news out of the state today that people will now have to wait till April 30th. But we will continue to monitor this and get you information as soon as we have it. There is a third benefit under the Federal CARES Act, which is that folks who go on unemployment, whether the normal people who regularly qualify or this expanded group, will also get an additional 13 weeks of unemployment benefits. The state is waiting for guidance from the federal government on how to implement that. So that aspect has not been implemented. So if you're already on unemployment, or if you've run out of unemployment and this 13 weeks will benefit you because you'll get that 13 weeks on unemployment, unfortunately, that has not kicked in yet. The state is still waiting on guidance. I do have an update on medical supplies. Excuse me. So the state was told today that we will get an additional 100 ventilators from the federal government stockpile. We have already received 100 ventilators from that stockpile. We are still waiting on what is, I believe, 1,500 ventilators that were requested from the federal government. Boston Children's Hospital has provided 5 ventilators that they have. And in some good news, the decontamination unit in Somerville, which can decontaminate up to 80,000 masks per day, is now up and running. So this will help significantly with bringing PPP to our frontline responders. In terms of helping out our frontline workers, the state has set up a site for temporary medical jobs. So if you would like to apply for a temporary job at the state's medical facilities that are being set up, like the convention center, like some of the testing sites, then you can go to their website and apply. So the website is mass.gov/join COVID team. We'll drop that in the comments after this. Positions that they're looking for are anything from respiratory therapists to nurse aides to housekeepers. So if you have background for one of those positions, please consider applying. They are temporary jobs, but they will obviously get you some income and also will help those on the front line. Now, I do want also to mention that now is the time to be checking on your neighbors and friends, not physically, if you can avoid it, but calling them, emailing them, texting them, hopping on a Zoom call with them. Those who have suffered or are suffering from sexual or domestic violence are particularly at risk right now. Those who are going through mental health struggles are particularly at risk right now. And so I just want to put that reminder out there to check on your friends and loved ones and neighbors, because there are a lot of people silently suffering right now. And even just calling, giving them a phone call might make a huge difference. Lastly, the Mayor of Boston, Mayor Marty Walsh, announced a COVID-19 Health Inequities Task Force today. So the purpose of this task force is to look into racial and ethnic inequalities or disparities within Boston pertaining to the virus. So there have been a lot of concerns the last few days and a lot of criticism that there is not enough data on who is suffering from this virus, and that when we do have data, it shows that the virus is disproportionately affecting communities of color. So this task force will be looking into these concerns. Now, I do want to just give a very quick legislative update. We did a bit of a long one on last night's update. So, excuse me, as of today, 88 bills have been filed in the Massachusetts state legislature related to COVID-19. They've been filed on everything from postponing the Boston Marathon to providing financial relief for local governments to providing support for small business owners, workers, homeowners, and renters. So 88 total bills. We will have on our COVID resource page, which you can find at megwheeler.com/COVID. We will have a link to where all of these bills are tracked so you can see the updates on these bills every single day. I will say, I just want to give a shout out to the representatives and senators who have filed bills to help various people across the Commonwealth. I think it's very notable when you look at this list of bills who has been on the front lines of ensuring that people all over our state receive the support that they need, especially those who are incredibly vulnerable populations, those who are being disproportionately affected by this virus. I think it's very clear who is fighting for those people. So thank you to our elected officials who are out there and continuing to do their legislative work to ensure that everyone in the Commonwealth has the resources they need to get through this. On the federal level, we have a few updates today. So I will say, so the White House has actually taken some precautions starting today as a result of someone in the White House press corps who started experiencing symptoms of the virus on Tuesday. That person has since tested negative, but nonetheless, the White House is taking precautions. So they are testing, they're taking the temperatures of reporters prior to the daily briefings. As a result, the daily briefing today did not start until just a few minutes before I hopped on here. So normally we try to incorporate updates from those daily briefings into this update. We have a couple, but not as many as normal because of that. If we need to, we'll eventually shift the time on our update if that's necessary. But for now, I just want to point that out. So if you've been watching the daily briefings, you may have noticed that today's was a little bit later. We're not sure if that will continue to be the case. On the unemployment perspective, 16.8 million people in the United States have now filed for unemployment. This is the second largest number of claims in the United States since 1967, which is when the Department of Labor started tracking this. This is 11% of our workforce. We obviously expect a significant increase in the number of claims to continue. We expect that the unemployment rate will rise considerably. So before this virus, it started at about 4.4%. We expect that to increase significantly. The economy is something that we will continue to talk about here on these updates, but also something you'll be hearing a lot more from me about because it is, I think, one of the most important issues that we're dealing with right now. And I think there are things we can do on the state level to support our communities and support our district through this, as long as we are ready to take bold action. So we'll be talking more about that in the coming weeks. The president was expected to announce either perhaps today or later this week that there will be a second coronavirus task force. The purpose of this task force is to focus on the impact to the economy specifically, and it will include the chief of staff, the Treasury Secretary, and the National Economic Council Director. Excuse me. The CDC has come out with some additional recommendations. So for essential workers who may in fact be exposed to the virus, they are highly recommending that folks take their temperatures before going to work, that they wear face masks at all times, and that they practice social distancing as much as possible. I know that a lot of our frontline workers and our essential workers, whether that's in the hospitals or in the grocery stores, have now started wearing masks, certainly in the hospitals, but in the grocery stores now, in the coffee shops, the gas stations are wearing masks, and I think that's an incredibly important step. Thank you to everyone who is making masks. I am not a sewer by any means, but I have started to try to figure out if I can do this so that I can lend some hands in this fight. I understand there are some masks that you can make that do not require sewing, so that is likely the path I will take. But thank you to everyone who is providing those. It's an incredible resource. So lastly, just to wrap it up in good news, so Dr. Fauci, who is the member of the White House's coronavirus task force and an expert on infectious diseases, said today that projections for the death toll here in the U.S. are lower than expected now. So they're predicting more like 60,000 deaths versus 100 to 200,000 deaths, which is what was originally thought. He was very clear that this is likely because of social distancing measures and people respecting the stay-at-home advisories or orders in their states, and that it is incredibly important that we do not let up on those measures at this point. So some good news, but I think, again, I'm always hesitant to say that because I don't want people to take that as a sign, especially as the weather is starting to get nicer, not today, but overall starting to get nicer, that it's safe to go out. I still think it's very important that we respect the stay-at-home advisory. I will continue to call on Governor Baker to strengthen that stay-at-home advisory. I really would have preferred to have seen it as a stay-at-home order. I'm still hearing reports of people who are not respecting the stay-at-home advisory, and I just want to say that it's incredibly important that we do, because we are doing the work for those on the front line who are risking their lives and are making incredible sacrifices for all of us. Staying at home pales in comparison to what they're doing, and it is for them that we are doing this, so that the burden on our hospitals can be lessened, and we can finally flatten this curve. So I'm gonna wrap it up there. I do just want to remind everyone that if you do want to help, one great way to do that is to donate blood. You can do that by going to redcross.org. You can make an appointment there. They have set up facilities and systems so that you will be doing this in a safe and healthy way. You may, in fact, find that you won't get an appointment for several weeks, and honestly, that's okay. Go ahead and make an appointment for the earliest that you can. They will definitely still need blood resources in a few weeks. So that's one great way to help. Lastly, I just want to remind everyone that we have set up a COVID resource page, megwheeler.com/COVID. We continue to update this page daily with lots of different resources depending on what in particular you need assistance with at this time. And if there's anything at all that you need, please do not hesitate to reach out. Our email is hello@megwheeler.com. Our campaign line is 781-724-3461. And again, you can go on our website, megwheeler.com/COVID, and find lots of great resources there. Excuse me. So I just want to wrap this up by saying, once again, as I do every single night, how incredibly grateful I am to everyone who is out there fighting for us on the front lines. I was reading a story just a few minutes ago before I came in here that a nurse had posted, I believe in New York, talking about someone that she had lost, a patient she had lost today. And, she said, it wasn't my first. He wasn't my first. He certainly won't be my last. but he struck her in particular because he had really fought hard and had held on. And because the last 24 hours were incredibly difficult, and she knew what was going to happen. And, his family was not able to be there with him when he passed away, but she stayed with him so that he wouldn't be alone. And, she talked about how what's happening now is so incredibly hard to bear. And gathering up his belongings after he passed away, putting them in a closet, in a bag, with so many other people's belongings just waiting for them to be picked up by family members once this is all over. And, I can't even imagine the strength it takes for someone to show up every single day knowing that they're putting their life at risk, that they are away from their families and their loved ones, risking their health to take care of other people, to make sure that other people get through this okay, and then having to deal with the blow every single time someone passes away from this. The bravery and the courage and the strength to do that is just immeasurable. And I am incredibly in awe and grateful for everyone who is out there fighting for us so that we get through this. I will say there are some good stories that come out of our hospitals as well. There are the stories of the people who survived, the stories of the people who, for whom it's milder and it's not as life-threatening and life-altering, and I think those are good stories for us to hear as well. But this virus truly does not discriminate, and it hits young and old. It is absolutely something that we were not prepared to deal with, and it is something that I think will take us a long time to recover from. But together we will recover from it. We will get through this, And I will continue to show up here every single weeknight for you, weekends if we have updates at 7:30 p.m. because I think it's important that you have a place where you can ask questions, where you can get an update, and frankly, where we can just all be together as a community. So thank you for watching live or for watching this on the replay. Thank you for being a part of the community. Thank you for everything you're doing to support our community during this time. And I will be back here again tomorrow night. So until then, please stay safe and healthy. And I will certainly be thinking about you and your family in this incredibly difficult and chaotic time.